Okay. So welcome everyone to this UCL Graduate Open event. We're going to be looking at the master's programs today from the MSc and MRes programs in the Department of Medical Physics and Biomedical Engineering. We've got a range of the course team, the team here that runs the various master's programs, and we've also got some students who we're going to interview and talk to later in the session. But we're going to first of all talk a little bit about the department and everything else. So I'll get started. My name is Billy Dennis. I am the Postgraduate Programs Director in the department. I lead various of the courses here, and I especially work on one of them, but we'll get to that in a bit. So a little bit to learn about first. These are the list of the people we're going to be hearing from today. The various of us, a bit nicer to look at the photo version though. So yeah, I'm Billy Dennis, and I lead the distance learning program of the MSc Physics and Engineering and Medicine. We've also got Dr. Rob Moss and Dr. Henry Lancashire, who work on the Physics, Engineering and Medicine on-campus programs and the various routes. We've got Professor Marinko Saranik, who is the MRes tutor for the department. Professor Matt Clarkson, who works on the medical robotics and artificial intelligence MSc. Dr. Andre Altman, who works in the artificial intelligence and medical imaging MSc. And we've also got Professor Ben Hall, who leads the research projects for master's students. So one of the most important parts of the course. Just a picture here. We don't have Peter today, who's our head of department, but just so you know who he is, to start us off. A little bit before we dive into the courses about our department. So UCL has a very long history in the subject area of medical physics and biomedical engineering, going right back to the first invention of the X-ray. The nearby hospital, Middlesex, was one of the first that used X-rays in clinical usage. And we've also got a history by the first academics in medical physics, that was Sidney Russ in 1913. These parts, access to central London, such as we've got, means that as UCL has grown since then, a lot of the departments and experience that was gained by the smaller hospitals has been amalgamated into UCL and UCLH over the years. So these days we specialize in engineering and physics and computer science, specifically as they relate to medicine and biology. So there's a few different things. And just to give you an idea of the size of the department, we're about 50 academic staff, about 80 pure researchers, that would be postdoctoral mostly, around 170 PhD students, with roughly 25 professional services staff to support us. Generally, on the master's programs in the department, we have between 75 and 100 students each year. So that's relatively quite small. And given the number of people you're going to meet today, you'll see. So that means we've got a great advantage for you as students, that we get to know our students really well, and you get a lot of personal attention as you complete your studies with us. So yeah, UCL, as much as we were historically one of the institutions that led the way in our subject area, that is still very much the case, with UCL being ranked so highly, 8th in the current world league tables recently. And our department's a big part of that. As I said, we know our students because we've got quite small numbers of master students. You get to spend a lot of time with your supervisors on your courses. And particularly, we've got the advantage of being here in central London with access to the many world-class facilities that are based both at the universities here in London, but also in the hospitals and the national bodies that are based here as well. So there's an awful lot for you to take advantage for as part of the course. A brief look at some of our research groups. There's a hell of a lot that is done in our department, very broad overall, but I would say that we're spread into these main categories. Looking at medical imaging is one of the most common types, and then radiation physics, so using X-rays and using cancer therapy methods, using protons and X-rays generally, and other methods relating to that. We've also got a very thriving, highly thriving group from computing areas that look at all kinds of different things, but particularly computer-assisted diagnosis and surgery-related applications, and also robotics that help support a lot of those applications in the clinic. And then we've got a number of groups that also look specifically at implanted devices into patients to monitor and treat various conditions, including electrical stimulation and all kinds of other types of monitoring that involve optics, amongst other things here. So there's lots of different things you can see in our research groups. If you want to know a bit more about them, then our department websites are really strong in terms of describing some of that stuff. So you can click on the MRI group, for example, and see what they do. You can learn a bit more about them there. So I'd encourage you to do that. As I said, the strength of the department is our collaborations, really. So that includes the number of specialist research centres we've got here at UCL. So like the Institute of Healthcare Engineering, we've got the Wellcome Centre, there's the RadNet, for example, Metabolite, various specific research units that have funding and work specifically in our subject. There's obviously the various hospitals and clinical units here in London, many of them world leading in their own subject areas that you can see. There is the links that we have got with many other top research institutions in England and around the world, in Britain, including like University of Cambridge, Yale, and even those that just do research independently of universities like the National Physical Laboratory or Francis Crick Institute. And then, of course, on top of that, medical sciences have a lot of industry that make products that are then sold to the output of these various clinical applications. And there's a list of some of the different clinical industry collaborators that we have got, ranging from the very, very large, such as Nikon and Varian, who make cancer therapy treatment machines, to the much smaller devices that are looking at sensors and perhaps all kinds of other things as well. So there's a nice range here that you can have a look at later if you like. But to move on quickly to why you're here, which is to learn about our postgraduate programs. Very broadly, our programs have a focus across 3 areas, which I kind of mentioned before. Now, all of these areas, you will be cross-breeding. If you do a physics-focused master's, then you will be required at some point to do a bit of engineering and certainly a bit of computing. And so is the case with each of the other streams as well. You'll always be required to cross-breed a little bit, but we give you the opportunity to focus on one of these particular streams. So we're going to learn about these specifically from the course teams. So rather than me explain it now, I think I'll start to pass over to them shortly. The first really is me. I suppose the MSc Physics and Engineering and Medicine. There's a team of 3 of us that lead this program that covers the 3 different routes that we offer. There's myself, and I lead on the distance learning program. There's Dr. Rob Moss, who leads on the radiation physics route, and Dr. Henry Lancashire, who leads the biomedical engineering and medical imaging routes. So I think I'll pass over, first of all, to Dr. Rob Moss, who's going to tell you a little bit about himself to start with, and then talk about the program of radiation physics. Rob.
Yeah, thank you, Billy, and hello to everyone. Welcome to the webinar. So I'm Rob Moss. I'm an associate professor in the department, and I'm the leader of the radiation physics group. I have research interests in developing things like new radiation imaging systems, particularly to look at the X-ray scattering properties of biological tissues and other types of material. I'm also interested in imaging secondary particles that are produced during radiotherapy treatments, with a view to using that information to optimize the treatment for better cancer outcomes. And also some of the more sort of what you might call underlying enabling physics, things like creating new detector technologies. Something I'm interested in is 3D printable radiation detector materials, as well as the development of complete detector systems for medical and nuclear security applications, for example. As well as the radiation physics stream leader on the MSc, I'm also the departmental graduate tutor. I look after the approximately 120 PhD students in the department. But this is important to you because you might also be thinking about doing a PhD in the future after your MSc. So if you have questions about progressing to a PhD or a research career, then please feel free to ask those questions as well. So if we take a look at the MSc program, specifically here, the radiation physics route, we can see that what we offer is a fixed IPEM accredited route or a flexible unaccredited route. And the program here is designed to develop key skills in radiation physics, with particular emphasis on the medical applications. And so you'll see in the first box here that we've got some core modules. And if you do the IPEM accredited route, then these modules are fixed and there's no opportunity to change them. So those core modules, along with the research components you see there in the second box, make up the whole MSc. If you were to choose the slightly more flexible route, then you have the opportunity of changing one of those core modules and choosing an alternative one from the box on the right there, labeled options. Next slide then, Billy. So accredited fixed route or flexible route, you might be thinking, well, how do I choose which one of those to do? So here's a few examples that might help you sort of have a think about that. So Sally, she has an interest in cancer radiotherapy, and she chooses to do the IPEM accredited route. And so as we discussed, this has got a fixed diet, but it sets her up really well for doing a job as a hospital clinical scientist, which would really get her involved with working with radiotherapy physics. Aaron is interested in radiation protection more generally. He chooses to do the unaccredited route because he realizes that what he's going to need is some good skills in computing if he's going to be doing things like Monte Carlo modeling of radiation enclosures. And so he then goes and works in industry for a radiation enclosure manufacturer. Kevin then is particularly interested in imaging technology. He chooses to do the unaccredited route because he realizes that what he wants is a few extra skills in medical image analysis. And this allows him then to go on to work in an ultrasound development company. But don't take these as like a fixed, these are the only things you can do. The MSc is incredibly flexible. It teaches incredibly transferable skills, and it opens up careers in a huge number of areas, not least in the healthcare sector, national laboratories, but also things that are a little bit more maybe you hadn't thought about, like the nuclear industry or even financial services. Next slide then, Billy, or is that it for me?
I think that's it for you, if that's all right. Yeah, so thank you, Rob, very much. Yeah, so
thanks very much. Cheers.
If you've got more questions, you can always ask Rob a bit later, but let's move on to our next program director, which is Dr. Henry Lancashire, who's going to talk about the biomedical engineering and medical imaging routes. Henry.
Thank you, Billy, and thanks for that introduction to the Fixing Engineering Medicine course, Rob. The biomedical engineering and medical imaging route, which I lead, is designed for engineers, and my research is fundamentally in engineering. I'm a lecturer here in the Department of Medical Physics, where I focus on the development of implantable devices for the connection with the nervous system. In particular, active devices, so things like pacemakers or neural stimulators, where we want to make those devices smaller, more functional, and longer lasting to provide better therapies for patients. BEMI, or Biomedical Engineering and Medical Imaging route, provides you a route to develop as an engineer in medicine. It's a flexible program. It covers the core engineering and physics principles underpinning modern medicine. It also has applied research and applies learning across medical imaging, medical engineering, and medical computing. The course is structured with 5 key core modules, some of which are shared with the radiation physics route and some of which are specialist to the biomedical engineering route, giving you that medical engineering underpinning. The research component is the same. You undertake a research project running through the entire year of your master's program, and then you can take 2 optional modules from a range of options, including computing, engineering, robotics, and imaging. Next slide, please, Billy. Examples of students who take the BEMI route include, for example, Leonora, who might have an interest in medical devices and engineering, and would then choose options such as materials for orthopedics and implanted human-machine interfaces in order to pursue a career as a biomedical engineer in industry. Rano, with an interest in clinical engineering within the environment, who could take topics including computer-assisted surgery and orthopedics, and progress onto a clinical engineering training program. Or Li Wei, with an interest in medical computing, who could take foundations in medical image analysis and computing in medicine and progress on to working, for example, within a medical software company. Our students take careers including in healthcare and academic engineering and within medical manufacturers, but also across financial services, software development, and more recently, some students taking law conversions. I think that concludes my brief summary of the Berry route. I'm open to any questions at the end. Thank you, Billy.
Thanks, Henry. Brilliant. I'll briefly mention another program which is attached to this one, which is run by myself, which is the Distance Learning MSc program. This is a distance learning version of the radiation physics IPAM accredited stream, very useful for people that need a bit of extra flexibility, either because they don't live close to London, so can't attend lectures in person, or because maybe they're a part-time student who has less available study time. So very common is people are currently working in a job, that could be a hospital job, or it could be based in other professions, and they're working their evenings and they're off time to complete the masters over multiple years. We've actually got an entire session on this, which is running next Wednesday. So I won't spend much time on this here, but if you'd like to join that and learn a bit more how exactly the distance learning course works, then do sign up for that. It's a slightly different study way of learning, but it's been accredited by IPAM, our course, exactly the same as the on-campus one. They're accredited together. They are equivalent, identical. They count as the same qualification, and it's a really good course. So I encourage you to sign up for that session next week if you're interested in that particular route. With that, I'll move on to our next course director, which is Dr. Andre Altman, who's going to talk about the MSc in Artificial Intelligence and Medical Imaging program. Andre.
Yeah, hi. Thanks for the introduction, Billy, and welcome to the webinar. So my name is Andre. I'm an associate professor at the department, and my research team essentially tries to understand how genetics is linked to what we see in the brain. In particular, we're interested in finding out how genetics shapes the pace and progression of diseases like dementia and epilepsy. And hopefully, we'll try to find ways to help develop drugs. All of this requires a lot of data analysis, and that's what brought me into working a lot with artificial intelligence, especially with medical imaging data. And so this is what this program really is about. It is responding to the rapid growth in AI in healthcare. So there's, I think, hardly any day that goes by when you don't see any news items about AI. And likewise, there is a growing employer demand on people who are skilled in using AI technologies, especially now relevant in the healthcare sector and here now in medical imaging. So this program is also designed to be an ideal starting point for doctoral studies. And it's also very closely tied to our own activities at UCL, in particular at the Hawkes Institute, which comprises two different sections, which were formerly the Center for Medical Image Computing. So essentially really working with medical imaging data, and the Center for Interventional and Surgical Sciences, essentially we're going to see from Matt later, where there's robotic surgery. Next slide, please. So this is the brief overview of the program structure. So we have a couple of core modules, and these are designed to provide you background in, advanced background in programming foundations, but also an introduction and advanced methods in machine learning with the application to medical imaging. There's image processing for medical imaging and so on. But the key knowledge of this is that we don't only just teach you AI and machine learning, but it's also called AI and medical imaging. So there's actually core modules that are designed to teach you about how those medical imaging technologies work. So you're going to learn about the physics of them, what are the problems, how they're solved, and how those images actually produced. And the key idea is that this helps you better understand what the challenges are when you afterwards work with those medical imaging data on a computer. So we have a couple of core modules. We also have, in order to tailor your experience a little bit, we have elective core modules. For instance, in term 2, you can pick either whether you're more interested in MRI and biomedical optics, or imaging with ionizing radiation. And on the AI side, we have a more or less general purpose module, which is called Applied Deep Learning, which is not specific to medical imaging. But we also have a new tailored module, which is about the applications of AI in medical imaging. So very, very focused on the challenges in medical imaging. Like with the other programs, we have a research project, which is something you're going to work on during the time at UCL. And above that, you have 2 elective choices from a range of options. So you can either learn more about medical imaging, pick modules that you haven't picked as part of your core education. You could pick, for instance, also the medical device enterprise scenario and essentially interact with lots of students in the other programs. And then we have other options which are very, coming from computer science, but computational MRI, computational modeling for biomedical imaging, and so on. So you have a bit of flexibility in whether you want to go more into the medical imaging area or more in AI and computational area. And as I said, this is a good starting point for either doctoral studies, but also given that you learn a lot about AI, you can apply it to healthcare settings, but you can also go into the finance sector, for instance, with what you learn there. And that's it for me. Thanks for listening, and I'm available for questions later.
Thank you, Andrew. Our next program director is Matt Clarkson, who's going to talk about medical robotics and artificial intelligence MSc. Matt.
Hi, I'm Matt. I'm a professor in the department. I joined in about 2008, I think, and did a variety of different roles in medical imaging and software developments. But my current research is mostly around computer-aided surgery and specifically using augmented reality to guide surgeons during laparoscopic liver surgery, or I have another project in endoscopy and a few other projects in general image guidance, if you will. So following on a similar theme to what Andre just discussed, so we've got this master's course that's been running for a few years now in medical robotics and AI. Again, the AI and certainly AI in healthcare is a government priority. It's a rapidly expanding field. Even just recently, yesterday, I think, Keir Starmer was presenting AI as a solution to many problems to try and drive efficiency. But really, I come at this from the perspective of an engineer. That the clinicians have certain things that they want to solve, and that we as engineers can work with clinicians to provide those solutions. So this MSc was created to sort of bridge that gap. At the time, it was the first medical robotics MSc course in the UK, and it's closely tied with what was called our Wellcome EPSRC Centre for Interventional Surgical Sciences. If you're looking for that website. If we move on to the next next slide. So we can see it's got a similar structure to the previous MSc in the sense that you get some core modules, some options, and a research project. So the core modules are taught. There's essentially your sort of robotics course it's linked to what we previously had in the computer science department. So robotic systems engineering, and also in term 2 medical robotics and devices. So taking that core knowledge of basically how to build a robot to what are the requirements needed when it's in a healthcare environment. And in the AI area, the core modules try to cover more about what you might be doing with or what data you might have. So for example, why is AI for surgery different to AI or computer vision like for example in autonomous driving? And then depending on basically what takes your interest, we've got some optional modules, so more robotics ones if you want to really focus on robotics. One that I teach called computer assisted surgery and therapy, and again some machine learning ones, and for general software skills, which is obviously very transferable, there's the research software engineering with Python. There's projects that you can now see that are common across these programs, like the medical device enterprise scenario, as Billy says, enables you to work on a group project with people in different cohorts and brainstorm and come up with essentially a new medical device. Every year there's a new problem to be solved, and students group together and design a new medical device. And throughout the year, students will be doing a research project. All of the academics in the department provide research projects, so you can choose to focus more in AI or robotics as you choose, really. And then new for this year, actually starting this term, is MRI guided devices. So one of our recently joined newer lecturers has developed a new course in essentially how do you make robots that could be used inside an MRI scanner. So hopefully that gives you an overview of the course. I think that's my last slide.
Great, thank you, Matt.
So any questions, I'll be available later.
Brilliant. So on to our final program that will be discussed today, which is the MRes in Medical Physics and Biomedical Engineering. Slightly different on this, and we've got Professor Marinko Saranik, who's going to talk a little bit about that. Marinko.
So thank you for the introduction. Thank you, everybody, for attending. It's a pleasure to be able to chat with you today about the MRes in Medical Physics and Biomedical Engineering. So this module is a little bit, this course is different than the other ones a little bit in that it is more research focused and less focused on taught modules. So it is still an important component of this course, but it is really much more focused on generating experience in research rather than courses, modules. Sorry about that. So it is a little bit more difficult then to talk about a specific direction, because what this course permits is a wider range of selection. The modules that you pick are less constrained. The projects that you pick are similarly broad and wide open. So it is emphasized at the bottom of this slide that with the MRes, it is a 120 credit research project, which is about twice the size of what you would experience in the more course module-based MSc course. And the key here is that the modules can be selected based on your interest, but also to help with the research that you'll be performing. A motivation for doing the MRes is to get that inside look as to what postgraduate research looks like, and to help prepare you for a research-focused postgraduate degree doctoral studies. So I think back to you, Billy.
Right. Marinko, sorry, would you mind just saying briefly what your specialism is, since everyone else is
yes, I forgot to introduce myself. Sorry about that.
That's
so
fine.
My background is in biomedical engineering, and I'm cross-appointed with the Department of Medical Physics and Biomedical Engineering, and also the Institute of Ophthalmology. So my educational background was in engineering and physics, so learning about semiconductors and lasers. And I had a real passion for trying to apply that technology to improving healthcare. So a nice natural combination of optics and medicine comes in imaging the eye. So myself and my research team develop medical instrumentation where we shine light, very low level, safe levels of light into the eye, and we try to generate medical images that will help diagnose diseases causing blindness.
Great, thank you, Marinko. Great. So that comes to the end of a brief description of each of our programs. We're going to just quickly discuss a couple of key parts that form a part of many of the programs, if not all of them. The first being the master's research project, which is worth either a third of the course credit or 2/3, depending if you're doing the MSc or MRes. And we've got here our project coordinator for master's projects, which is Professor Ben Hall. So Ben, would you mind talking a little bit about your research?
Yeah, of course. Good afternoon, everybody. Thank you for attending. I'm Professor Ben Hall. My specialism and my interest is in computational cancer, and my group focuses particularly on understanding aging, pre-cancer, and cancer development. We bring in a variety of different topics within physics and engineering to try and help us understand these systems and identify better diagnostics and better treatment, ranging from molecular biophysics to formal verification of gene regulatory networks. I'm talking today about the research projects, though, which are part of the MSc and MRes degrees. Now, these are fundamental parts of the degrees because in these projects, you get the opportunity to address novel research questions in a real working environment. These give you the chance to engage with some of the top quality research that takes place in UCL and with UCL partners. You'll get supervisions from experts in the field, learning from them, learning from their lab, picking up new techniques and applying them in a real context. So this gives you a much deeper appreciation for the kind of work that is done, how you an ability to apply the research and dive very deeply into a specific topic and develop that new kind of expertise. Because of the way that the research projects work, they actually develop a huge range of transferable skills. These can include data analysis, modeling, computation, to communication, through poster presentations, through talks, and through written communication. And so these really give you a unique opportunity to test yourself, to develop into new space, to apply your skills, apply your knowledge, working as part of a team under supervisions of the world-leading experts. If you could switch to the next slide, please, Billy. This part of the course actually draws on the real diversity of expertise that exists in our department. Medical physics and biomedical engineering is a massively broad area, ranging from engineering, technology development, to radiation physics, to AI, to the interface between surgery and computing. There's a massive diversity of topics that you can engage with, and some of these slides just give you an indication. Some of these posters from previous years gives you an indication of the kind of projects you can do. You've got a huge selection of projects that are offered by different people in or associated with the department that you can pick and choose from, and really get the opportunity to develop your interests, your skills in a practical environment. Thank you for listening, and I'll hand it back over to Billy.
Thank you, Ben. Great. Yeah, I'll mention one more module, which is fairly common. You've seen it mentioned in a few slides already. This is the medical device enterprise scenario. Matt briefly described this, but basically this is an opportunity for you. You can see we've got many courses in the department, but although we consider you really as part of one cohort, the idea of this module is to make use of the fact that everyone has all these different expertise and different backgrounds to actually build it together to build like a real engineering team that can come together and solve a problem. So each year we give you a brand new problem, and we ask you to make a medical device to solve it and to make a business plan that you could then take away to market as part of it. So it's usually one of the more enjoyable parts of the year. You get a lot of freedom in your groups with all the different students to come up with whatever you like. And because it's really defined by you as students, it's kind of unique in the course. You're not doing someone else's research here. You're doing whatever you can. And often it's some of the most useful skills that you'll develop as part of the masters. So just to give you an example of some previous years ones, here robotics to help in care homes, and we got students who made a special type of bed that equalized the pressure using these little pistons moving up and down. So one problem is patients can get bed sores if they stay in one position for a very long time, or if there's lots of pressure on a particular part of the body, on their hip or something like that. Those bed sores can take a very long time to heal and a lot of treatment time with the nurse. And so this is the device that helps measure those pressure points and then equalize them. So really nice there. This one in the middle is an auto commode, which is a toilet that will come directly to the person's bed. So if there's an emergency and the patient is immobile, then it will follow a pattern on the floor, deliver the toilet to the person so they can use it, and then it will take it away and clean it. It's quite nice. And then for another year, we had an example of technology for the visually or hearing impaired. This looks like a mouse, this particular device, but it's actually a Braille reader. You can scan it over the top of any book or any text or any iPad and things like that, and it will translate it to Braille on these little pins you can see on the top of the mouse there. So a really nice idea for a device. But really, it's about the business opportunity of trying to make these things and how can you sell them to investors? How can you follow the regulations to make sure that they could actually be produced? So ideally, it would be great if students, when they finish the MSCs together, they actually start that medical device company and go away and take on the world and invent new devices and change things. So one of the more interesting parts of the course. There's a link here, which I think we'll probably move on because I'd like to speak to our student ambassadors. But if you want to see a little taste of the talk course, there's a video which I think Julia should put in the chat as well, just a video from one of our professors, Professor Karen Shmoeli, talking about her MRI program. So if you want to learn a bit more about that, that can be a useful way of learning about the subject. And there's also the department podcast, which has got episodes on a number of different research topics, very accessible to anyone from any background, really interesting, and includes some of the people that we've heard from here today as well. So I recommend you go and have a look for that. That's on SoundCloud and Apple Podcasts, easily to search for. I'll briefly go through a few other bits, and then we'll speak to our student ambassadors. A typical week studying on a master's with us is between 12 and 16 hours of lectures, and then about 10 or 15 hours you expect to spend with your projects each week. So every week that's going to be a large part of the course, as you've seen. Then you might have some problem-based learning classes that, if it's computing, then you'll go through computing problems. If it's physics-based, you might have physics-based problems, and there's a range of all of these different things. And you're expected that you'll meet with your personal or your project supervisor 1 hour a week as well. On top of that, tutorials you'll see fairly regularly. They normally form parts of the medical device enterprise. So your group that you're working with to invent this medical device becomes your tutor group as well. So a good opportunity for you to communicate with other students. And the idea is we deliberately mix them up so everyone gets a different exposure to new people and new ideas as much as possible. That cross-breeding is key for the success of the department, for our research teams, and it will be key for you as well. Assessments, very briefly, at UCL, all exams are taken in April, May. In term 3, there's no January exams, and then every module has some form of coursework usually. Now, depending on the module you're taking, you might actually even not have exams. A lot of the computing exams have coursework rather than exams, but just so you know roughly how these things fit together. And what do we do when we graduate? Well, anything really. I don't think I need to add any more here because we've talked a lot about this, but I will just highlight the excellence of the UCL Engineering Careers team, who can help you find a career whilst you're studying here in the program, but you also get access to them as an alumni for 3 years after you've graduated, and they can help support, find you jobs, they can help you with applications, they can do all kinds. So I'd strongly recommend making use of them. They're an excellent resource. Very briefly, minimum entry requirements. It does depend on the masters individually, but nearly all our masters require at least a 2-1 or from a UK bachelor's degree or international equivalent, usually in a subject that's related. So physics, engineering, computer science, it really depends slightly on the program there. And then on some of the programs, physics and engineering and medicine, for example, there's a possibility we do accept students with a 2-2 degree, and you might be asked to come for a short interview as part of the process. So we're generally looking for quite strong students. A little bit about the finances, the course fees for this year on the screen, and then if you need some look at funding your research, there's a number your masters. There's a number of ways of doing that. Postgraduate student loans from the UK government are one avenue that many students take, and there's also a number of UCL scholarships. But bear in mind that you'll probably need to apply for those before you actually come to UCL. A lot of the deadlines, as you can see here, are this year before September when you would be starting the course. So something to look out for. The advantage, well, of being in London, something we haven't even really mentioned. It's one of the greatest cities in the world with a massive range of different things to do. All the sports, cultural, the arts. We're right in the West End here. So theatres, if you're a big fan of that, there's a fantastic opportunity for you to go join in that culture, basically. UCL has a lot of different societies and clubs that make use of all of these different things. There's just lots that you can do here as a student. London's a really fantastic place to live and study, and you'll get access to that as well, obviously, as a student here. So I think we do have some questions, I noticed, from everyone else, but we've also got time very briefly for some questions with our two of our current students. So we've got Gabriella and we've got Prabhav, who are current MSc students on our course. Would you mind just joining Gabriella and saying hi? And
Hi, I'm here. Can you hear me okay?
yes, I can. Great.
Okay.
Gabriella, I'll start with you if that's all right. Could you tell us maybe about yourself, what you're studying, and how you
Yeah, so a little bit about my background. I've been in the UK for 5 years. I did my undergrad in Manchester in neuroscience with a year of industry experience, and I did my final year project in an AI related project for neuroscience, tumor segmentation in brains. And as part of my application to UCL for the Masters in AI and Medical Imaging, I presented my project and I got accepted with an offer to the Masters. So that's kind of an example of a non-traditional avenue to getting into the program. I think Pranav has more of a engineering background. Pranav?
Okay, yeah, Prabhav, would you mind telling us about your background first?
Hey everyone, so my name is Prabhav and I'm currently doing MSc in AI and Medical Imaging. So I did my undergrad, a Bachelor's of Engineering from India in Information Technology, where I did my thesis in medical automatic segmentation. Am I audible?
Yeah, I can hear you. Yeah, great, thank you.
Yeah, so I did my bachelor's thesis in medical segmentation. So while in engineering, my experience was I was totally interested into AI-based systems. And for there on, I got my penultimate year of internship in biomedical, and my interest rose with doing some AI work in medical domain. So plus getting to see this program at UCL, so it totally aligns with my research interest. So it's a good experience to be here. And being an engineer, it was quite amazing because I remember one scene, it was the biomedical ultrasound class. And for our lab work, I first time used an ultrasound machine. So it was an amazing experience to be. So the program helps in a lot of ways. Plus I'm doing my master's thesis in multimodal AI for histopathology. So the whole program system just helps in my interest. Also, one thing I'll give tips for the people coming, before coming or before joining, if you got your offer letter, you can even brush up your Python skills. And if you're more interested in the computational side of the program, you can brush up your Python skills. But the program has all the introduction modules plus the advanced modules for the layer. You will get into them later on. So yeah.
Great, thank you. Gabriella, would you mind telling us about your master's project that you're doing?
Yes, so I'm doing a project that evaluates brain microstructure in children with a specific rare genetic disease using MRI imaging, diffusion MRI, which is a technique that I wasn't necessarily familiar with the background. But I'm working actually in the Institute of Child Health, so not within the department, but I'm working in another institute where it's just focused on children's research. And yeah, I suppose it's quite an interesting project and it has a lot of meaning, especially given the expertise of the actual research group that focuses on just children with rare diseases. So yeah.
Okay, great. Thank you very much. If you wouldn't mind sticking around, perhaps if anyone's got any questions for you guys, then they can ask them as well. But I think with that, we'll move on to the question and answers. I can see some people have put a number of questions in the chat already, which is great. I might just look through the ones that we've already answered briefly to see if there's anything to add. I can see that Rob has spoken, but that's great. Let's just perhaps answer these out loud. So the first was, I had a question: upon finishing the MSc course, how does the process of becoming a clinical medical physicist in the UK via Route 2 work? Will there be some sort of recommendations to hospitals for potential employments throughout the length of the course? And Rob has mentioned this briefly. Rob, do you want to say this out loud, just very briefly? And I can add to it a bit as well, because it's somewhat my area.
Yeah, so I've written here a response that there are opportunities during the course to learn more about the careers as a clinical scientist and the different ways that you can become registered as a medical physicist, for example. It is possible, and I've done this in the past, where I've linked up some of my some students with previous students that have gone on to do clinical scientist training by either route, and so that can be a useful resource. So yeah, that's kind of the response that I put in there.
Great. Yeah, I think that's good to hear. I mean, it's worth saying as well that it's very common for students on the physics and engineering and medicine programs. On the dark. To go this route. The purpose of the IPEM accreditation largely is to make it easy for you to become registered as a hospital clinical scientist. We have a number of students who study part-time, both on the distance learning degree, but also on campus as well, and they'll be working often in hospitals and studying the masters they need for their route to registration, as it's called. So route 1, I mean, that's not an official term, but route 1 would normally be through the dedicated UK STP program, which is a national program where they teach you the master's level study you need for your clinical sciences registration, but also give you the placements in the hospitals to build your skills portfolio in the workplace at the same time. They'll organize that for you. Now, many hospitals, there are places, it's a fantastic course, that one, but there aren't many places, not enough for the amount that we need in the UK for people working in that industry. So many students go through this route 2 process, which is do your own masters and then work in the workplace. Now, some hospitals will offer you a position to train you, and they might even fund your route 2 masters at the same time. But we've also got a number of students who do the masters with us and then go find a route 2 position in the hospital. They work, that's a paid position immediately, and so you can then develop your career that way. So that's a very common route. Yeah, we've got a lot of expertise. In fact, our former head of department, who's now the Dean of Engineering, ran a lot of the Surrey Hospitals Trust programs for new clinical scientists. So we've got a lot of experience in this area. Many of us in the department have done the various forms of training to be a clinical scientist. So yeah, there's lots there for sure.
I have one more thing to add there, actually, Billy, that I see it sort of suggests, do we have recommendations to hospitals? We don't. We don't have hospitals that we send you to do these jobs. But I would say that trainee clinical science type of jobs come up all the time in the UK. So don't think they just come up at the end of your course. Be looking for them all the time. And of course, we're happy to support you in supplying references and that kind of thing.
Yeah, and it's fairly common a number of times a year that the hospitals, when they're looking to advertise these positions for route 2 jobs, they're looking for a master's student, and they might email me or Rob and ask if we could forward this to our MSc students. So we will do that when we can. But as Rob said, there's a lot of positions that can come up. So that will help you and give opportunities. For example, there was an open day at UCLH, which is the hospital attached to UCL, that was in December, that was talking through some of these things directly. So yeah, we'll give you all the exposure we can. We're very experienced at supporting people down this route, obviously, because it's one of the main purposes of it. I'll answer this next one next. This was for the in-person MSc. Are the exams open book and online, or closed book and in person for 25-26? Henry's answered that one. Henry, do you mind just briefly summarising again, if that's okay out loud?
Billy, so as Billy mentioned during the presentation, exams are a mixture of closed book in person and online exams, along with some taught modules which are assessed only through coursework.
Yeah, and it's worth adding as well that obviously in our department, because we've got a distance learning course, in fact, run by myself, we've got a lot of experience at writing suitable exam questions for online open book assessments as well. And so there is a trend right now, obviously with ChatGPT and things like that, which making these assessments fair and that they're actually assessing your understanding can be tricky sometimes. So some universities are going back to completely in-person exams. At the moment, we're holding with a bit of a mix. That's down to the module organisers to decide whether they think their module would be appropriate online or not. So there's a bit of a mix there still currently. On to next questions. What is the acceptance rate for admission for the MSc? This says by distance learning, but I think we'll talk on each of these perhaps. So, we're looking for good applications. At the moment, the places on all these courses are not full. So we still encourage applications now. I think the deadline for applications can be either the end of March or the end of July, depending on how it looks. And at times in the past, UCL has extended that deadline a bit further. I would say the earlier you apply, the better your chances will be of getting a place on the programme. And if you're an overseas student who needs a visa to study here in the UK, then I would strongly advise applying by April, please, because the time to get the approval for the visas can sometimes take months. So that's something to think about. Matt or Andre, do you have anything to add there? I suppose I'm sort of talking for the physics and engineering and medicine programs there. But...
No, similar.
Okay, great.
Yeah.
So there's the acceptance rate. It's not really relevant. If you make a very strong application, you'll get a place largely. That's what we're looking for at the moment. Yeah, it's particularly at this time of the year.
Okay. I guess on that point, the MSc in medical robotics and AI, and possibly I think Andre's course this year, they will be probably oversubscribed. So you do need to focus on making the best possible application. As in, just because someone has a 2-1 doesn't mean that they will definitely get an offer. So 2-1 is the minimum for UCL.
Yeah.
But if the course, if we have more applicants than places, we have to prioritize them.
Okay. Next question was, how often do entrepreneurial ventures come out of the artificial intelligence and medical imaging stream or other streams in general? Is this something that is supported or encouraged? Andre, do you have any specific to say here?
To be honest, I mean, the program is running now in its second year. I haven't heard of any companies that were spun out of last year's cohort. I mean, we pretty much focus on the education part. So all the other bits, I think, if students find, a group that want to start something with, I guess there's general UCL support, but it's nothing specific to the program, I would say.
So I would say as well, the general UCL support can be quite excellent, actually. So there is the UCL Incubator Hub, which is designed for academics and early career researchers, but also potentially students as well, to help to learn about entrepreneurship and hopefully spin out some of what they learned into different subject areas. That requires, you to take a lead for sure, because that's the nature of entrepreneurship anyway. But there is some resources and grants that you can apply to that help you do a lot of these things. And there's a big community of people doing this kind of stuff. Even some of the people in this call who've maybe done a little bit of it themselves. I don't know if anyone else has anything to add there.
There's also the UCL MedTech Society. So I think, say, for my course, it's not been running that many years, and it is fair to say it's a very busy course, and I don't really track who goes off and makes a spin out. So it's probably more likely to see a spin out at the end of a PhD program. But that said, in computer science, they're, I guess, more proactive in commercializing AI solutions. So via the computer science department, as Billy says, there's a lot of seminars, a lot of workshops to encourage students to go off and do this. But myself as a professor, I don't track this. And certainly you've got to find the time to do it. So I don't track it, but I think it's to be encouraged for sure.
Yeah, right. Yeah, I absolutely agree. UCL is very keen to encourage that and even support it, and there's lots of people looking into it. So yeah, there's good expertise in the department as well. On to the next question. Is it possible to become a medical physicist in the NHS with this MSc alone? Because I've not found many jobs that do not require the STP. So it depends on the job, basically. So to the clinical scientist positions that we've mentioned, that's a registered position that you can only have after working in a hospital for a certain number of years. You can do that via the STP or by what we said as Route 2. You would not be able to go straight from the master's to the registered clinical scientist position. So that might be medical physicist, it might be dosimetrist, it might be radiotherapy planner. But those posts, before you've got the registration, which usually takes 2 to 3 years, maybe more, they're called trainee positions. Now they're still paid, they're still reasonably well paid going forward as well, but you'll be a trainee dosimetrist, a trainee radiotherapy planner. So that's the post you would need to move through. That training is compulsory part of every job, and similar to how you can't go straight to being a consultant as a doctor, you need to do the training as well. So the first stage is that you become a trainee clinical scientist in whatever the specialism is. What is the typical weekly schedule in radiation physics routes, IPM accredited, look like? How intense is the coursework? Rob, would you like to?
Yeah, I think this question came in before you got to the slide in your talk. So yeah, just to summarise, a typical week is sort of 12 to 16 hours of lectures, with sort of 10 to 15 hours per week that you devote to your project, as well as additional classes that occur maybe not every week, but problem solving classes, that type of thing. And you might also find that you have time, maybe sort of like on the scale of once a month, where you might meet with your personal tutor, for example. I think the project is something that's really important. It's really important to make sure you keep up the tempo with it. I think Ben would agree. It's very easy to put the project in the background. So sticking to a good number of hours in the lab or working on the project every week is really important. I don't know if you wanted to chip in there, Ben.
No, I completely agree. I think the research project is important in so many ways. I mean, you obviously saw how many credits it's worth. There's that, particularly in the MRes, but that reflects part of its importance. But there's something you learn about doing science that you don't learn in the same way from lectures. And so you have to engage with it in a way that you can do. The other thing to bear in mind is that whilst some people may be able to do short stints of work in a run-up to an examination, again, a research project, which is essentially a working job, is not going to be amenable to that. So you need to be putting in the time consistently throughout the course in order to achieve it. You're not going to be in a situation where you say, oh, it's 2 weeks my deadline, I'm just going to do all my project now. You've got to pace yourself. You've got to see how your results pan out, because of course research is inherently an uncertain process, and then you've got to be able to respond to them. And the only way you can do that is by constant, consistent engagement throughout the year.
I think in terms of what you're asking as well, I mean, full time, the Masters is a busy year. It's just what it is, 35 to 40 hours and maybe more, because as Ben said, the open-ended nature of some of the project, for example, means you can spend as many hours as you like. In theory, the more you do, the better your research will be and the better your marks will be at the end of it. So it's a busy year for sure, and it really is full time. So there's part-time structures, and you can talk to me about those if you like as well. But yeah, that's sort of the feeling of that. Someone's asked, after contacting a scholarship advisor, they advised to ask whether the department has their own fundings in addition to the common scholarships. So I think I can answer that. Our department doesn't have a specific scholarship fund that relates to our course. We contribute as part of the UCL ones generally. So no, I'm afraid there's not a specific department scholarship there. Next question, will the medical robotics course cover the foundations needed in robotics, such as kinematics, or is there any concepts that should be a prerequisite?
Yes. So yes, it does cover it. So it starts with a kind of core robotics covering kinematics, motion planning, different types of robots, programming with Python and ROS, and the theory you need to do that. So I myself have never built a robot, but so I'm reading from the course catalogue. So, but yes, it does cover the basics. A lot of our applicants have done some robotics, but a lot haven't. So we do start. So a lot come from courses, I say general mech eng or computer science or even electrical engineering, and they want to have this on their CV. So the aim is that you can come from quite a diverse background.
Great, excellent. Next question. I am an MBBS graduate, that's a medical school graduate, looking to transition to the MSc Medical Robotics and AI due to my relatively stable background with regards to mathematics, computer science, and hobby robotics. For mathematics, it's equivalent to A-level and further A-level by UK standards. I'll be completing a course about using Python for research relatively soon. Is there a possibility for me to transition into this field by UCL? Matt, I think, because they're asking about your program.
We did have a medic last year and he did very well. Although, because it was the first medic I had made an offer to. I spoke to him first, and you know, we basically talked it through and said, if you can get all this Python done before the course starts, I'll make an offer. But just be aware, it's a lot of work if you haven't done engineering. But the plus side to this is that medics who have done a medicine degree often do very long hours and are very good at studying. So I think it kind of evens out. So I think, again, with a strongly written application, there's no reason you can't apply.
Yeah, I think like that. It's unusual for the other master's programs as well, but we do see the occasional ones, and it's down to the individual. Yeah. Sorry.
Yeah.
Okay, great. Next question: does the STP route to applications friendly to those that require a work permit non the EU? Okay, so in other words, can you apply to the STP route too if you need a work permit? That is potentially possible. It really depends. From my experience of seeing other students, we've had students who have got those work permits, and some of them who have found jobs saying, oh, you need to already have your work permit beforehand. So it really does depend. The answer is both yes and no. Sorry. Next question: how much biology knowledge is recommended as a prerequisite to these MSc courses? I think I can answer certainly for the physics and engineering and medicine, none. You'll be fine with 0, largely. There is a part of it, an anatomy and physiology course, which is one of the modules that teaches you what we feel is required for imaging related study and for radiotherapy related study, amongst other biomedical engineering. It's a common course that's done across the engineering faculty, actually, and gives you some basic there. And depending on what subjects you're doing, you might do a bit of extra cell biology, depending on your modular choices and things like that as well. So the requirements of biology is none for our department. I think I'm correct in saying that, unless anyone wants to contradict me. Thank you. Question on the MRes. For the MRes, are projects chosen from a pre-allocated list advertised in September, or is there another selection process? Marinko or Ben, do you want to answer that maybe?
Yeah, I can jump in and say I think it's a little bit of both, and I think the MRes is really an opportunity to jump in on projects that excite you. Definitely take the time to browse through the research profiles that you see on our web pages, and don't hesitate to reach out to the different research groups to find out if there are projects that are specifically in the topics that you find exciting.
Yeah, they asked, is it recommended to contact potential supervisors before applying? If so, should we mention the research topics and groups in our personal statements?
So I can give you kind of a follow-up answer for Marinko's answer. So, you know, we have a big database of projects that you can pick from that come from all across the departments and from our partners and close collaborators. But there's no reason you can't also approach a group whose work you're particularly interested in. So, for example, if you know there is an area or a particular professor or research leader who you really want to work with, you're really interested in, there's no reason for you not to contact them and to ask if they're putting a project, or even if you've got a specific project in mind, that you can do that. So, for example, distance learning students can actually propose their own projects. So there's a lot of flexibility in terms of the projects. You can pick from the database, you can approach people and encourage them to submit something to the database, or to, that may have some advertised somewhere else, or you can develop your own projects. There's quite a lot of room. So with regards to the comment, is it recommended to contact potential supervisors before applying? I think if you're wanting to develop your own project, the sooner the better. But with regard to the database, and for what is relevant for most people, will be once you arrive, the database will be initiated, hopefully in time for your induction day. And then the process of you picking a project is you read through the database, you pick some of the projects you're interested in, contact the supervisors then to initiate a discussion about what it would involve, what it requires from you, and whether this is a good fit for you. So that is part of the process, and that conversation is part of the process. And a big part of this is that research projects are part of a relationship between a student and a supervisor. And so you will be talking to them in the selection process, and you'll be talking to them a lot throughout the process of the year.
Great, thank you. And the third part on that question was for part-time students, the recommended structure is to complete taught modules in year 1, and the projects in year 2 is their flexibility. And if following this recommendation doesn't mean project selection only occurs in year 2. So yes, that is the current process. So if you're part-time, you'll actually study on the MSc, you would do 4 modules year 1, just taught modules, and then year 2 you do 4 additional taught modules and your research project as well. The research project runs from October through to August, so you get a bit more time over the year. That's why the extra workload sort of works best that way. In terms of starting your projects early, there's nothing potentially to stop you. Those conversations that Ben was just talking about, it might be worth having conversations with supervisor, perhaps after your exams at the end of year 1, before going into year 2. It's a workload issue mostly, particularly with part-time students. We don't want to put any student in a disadvantage where they've started to work on something, or their work on modules they're registered on is going to be compromised by trying to do too much in a project at the same time. There's also the same part that we're not supposed to deliver tuition, including supervision, unless you are registered on that module that year, and you can only be registered on a project for 1 year. So it just makes sense to do it in your second year, but there's definitely some more informal ways you could potentially get started and start the literature reviews and looking into these things earlier if you like. And in fact, it happens fairly commonly with the distance learning students who are often based remotely and might start their own local project slightly earlier. I mean, in theory, the earlier you start, the better, but there's always a workload concern, but you can always discuss that with us when you join. So there's opportunity, there's some flexibility, but you really need to take that project in your final year. That's the only way it works. And then last question I think we've got here, which is, will the slides used today be available? If so, where can we access them? I think might need to ask Julia about that, but this session is recorded, as you know, and it's going to be put up on YouTube, on the department YouTube channel, so they'll certainly be available there. We probably will be able to make the slides available as well somewhere on our department website. I'll talk to Julia about doing that, but I think we can send out messages to everyone that's attended here today to let them know about that as well. So we might be able to include it in that. I'll talk to Julia, who you all met already, our department communications officer. Okay, does anyone else have any other questions? Have I missed any? I don't think so. Okay, in that case, thank you very much for attending. If you've got any further questions, then feel free to email us. You can see there's email links for the various courses that you can look. If you look on the graduate prospectus page for each of the masters, you'll see there's a contact on there to ask questions about the programs. We try and respond as quickly as we can. So if you've got specifics you'd like to know about, then do let us know as well. And again, finally, just from my point of view, if you're a distance learning student, we've got the session next Wednesday, so feel free to come along to that as well. But other than that, thank you very much for all the panel members for attending and answering the questions, and thank you for joining, and hopefully we'll see a lot of you studying in London next year. Okay, thank you.
Thanks.
Bye, everyone.
Thanks, bye.
Thank you. Bye-bye.